Welcome to another episode of the Pulse of Healthcare. This is Dr. John McCormick. I'm here with Peter as usual, and today we're going to talk about claim denials and how come denials not only hurt the providers and facilities but hurt the members.
And when it's part of a plan, for recovery, and that's what the doctor orders, how does some clerk at the insurance company say, no, that's not valid?
Well, so let's talk about that. So we've got two issues in play here, right? So we've all heard, delay, deny, those things when we're talking about the major carriers. And so some element of that is programmatic. There's a process in which claims are received and are denied, and what I would consider denied for probably frivolous reasons. The claim might be valid, but some kind of coding error or something. Remember, human beings are putting these things in. But when you see claim denial rates that are a third of the claims submitted, there's a big problem.
Well, they have to be getting thousands of claims.
Hundreds
So
of thousands.
There's not a person reviewing it, it's computer.
It's a computer, right? So I said it's programmatic. It's something in the program that's doing that. And that also feeds into the fallacy of, well, I'm with the major carrier and I did everything I'm supposed to. I went to their network doctor, I went to their network hospital, I went all these places, and then my claim was still denied, right? I'm in
Right.
that third. My claim was still denied. So what's the impact of all that? Well, that means my doctor didn't get paid.
Right?
The facility didn't get paid. And depending on the facility and the doctor, I might now have, some kind of balanced or surprise bill because as soon as it rejected from the carrier, it hit the automated system of the major hospital, who then just said, oh, well, when you signed up for this procedure, you said you'd pay anything your insurance company didn't pay, which you should never sign, by the way. All right. I mean, that would be insane, right?
Right.
I don't do that. And now you're looking at a bill and you're like, hold on a minute, I don't know this bill. And you're calling your health plan and they're like, oh, we can't help you. They don't, after spending 4 hours on hold, you don't get any help at all. Or the
Right.
person you're talking to doesn't know, or they can't look it up, or or you end up getting transferred 4 or 5 times, and it's a nightmare.
Well, if I understand the timeline, doctors that don't get paid for up to 90 days, 120 days when a claim is filed and approved. So they're going what, 6 months plus without.
Even when it's good, right?
Yeah.
So we're reading all the article all the time about a lot of rural hospitals and things like that, and they're going bankrupt, and they're going bankrupt because of their revenue cycle management, right? They're doing all the billing, they're expecting payment, they don't have a lot of money in the bank to begin with, and then payments are delayed 60 days, 90 days, 120 days, and when a claim's denied, it starts the process over. They have to refile the claim, right? So first they have to get it back. They have to recognize they get it back. And it's not like, oh, buddy, you got it wrong. Would you just adjust the CPT code or the revenue or the code on line 2 and resubmit it and it'll be all good to go? No, they have to analyze what they submitted, figure out what they did wrong, if anything, and then resubmit it. I like to say resubmit it for further denial, but it's mind blowing. And these are the people
Yeah.
with the contracts, and hospitals going, thank you, major carrier, for renewing our contract. We love you. Why? Why do you love them? They're not paying you. They're surely not paying you timely.
Right.
And it doesn't make any sense, right? You know, so a lot of the conversations we have is, well, what's your denial rate? And I go, our denial rate's like 2%. What do you mean 2%? Major carriers are at 30+%. You're at 2%.
Well, having the patient advocates as a guide in the process, it makes all the difference in the world.
It's almost like pick your headache, right? I had somebody say, I don't want to have to call a patient advocate to get a doctor's appointment. I'm like, are you calling your doctor to get a doctor's appointment? Yeah. Why don't you call us? We'll answer the phone, and then we'll sit on hold with your doctor to make your appointment for you. You just go, hey, I needed a doctor's appointment. Blah, blah, blah. These are the dates I'm available. Great. Done. Same thing with it. Why do we not have denials? Because we pre-coordinate the care. We have agreements. In many cases, we're doing bundled services in cash. And when we do get a claim, it's a claim that we know is coming through a procedure that has been coordinated through us. So there's no reason to deny it. The reason we end up with weird denied claims is because we're getting a claim generally from a service that we've already paid for. That counts in our 2%. Oh, I'm sorry, we paid for that up front and you're sending us a claim, we're not paying that. So it's really a double, a double bill.
Yep.
Or it's something that we have a capitated service for and we're getting a claim for that capitation. So as far as just straight up denials of claims, almost none. We don't receive claims that are like out of the blue. We don't know about them. Now, granted, do some people go to the ER room? Of course they do. Do those claims get denied? Maybe. Most of the time that has to do not with the denial, but actually an evaluation of the claim submitted versus what our allowable payment is. That's not a denial. That might be a reduction in reimbursement based on what the actual medical record says. And so let me give you a quick example of that. You have a member that goes to the emergency room for a tummy ache and they get discharged with a prescription for Pepto-Bismol and we get a level 5 charge.
That's what people do not understand is the different charges in the same place, the same hospital, in the same room, but depending on what level of illness they have, and it gets rated that way, it sets the prices.
Right. I mean, we look at that and we go, we know that's a level 1. And so, we're happy to pay it at level 1, but we're certainly not going to pay it at level 5. As the fiduciary advisor for our groups, that's our job. Our job is to be able to look at those things and do that. And I know last week we talked about, some of these other TPAs are paying more than bill charges, and they have these weird agreements. And we're talking about major carrier TPAs managing self-funded plans, not fully insured, self-funded plans. So when you dive deep down into their, ludicrously long contracts, you see all this weird language like, we may pay more than bill charges. I will pay triple for that steak as opposed to what the value of the steak is. But that's the insanity that's buried in these contracts, and we need to warn people, you should look at all of this.
Well, when you combine that with the error rate that in the billing that comes, which I've seen estimates as high as 99% have some type of an error in it, not to the customer's favor.
Right. Absolutely.
It's a mess that they really need to take the time and have a guide like one of our patient advocates walk them through it. It's a different world than it was, and you cannot continue to do things the way you used to do them and expect different results.
Absolutely. I mean, there's entire businesses out there that's entire role is working with people who have received balance bills and going back and fighting with the hospital or surgery center or provider to get those claims adjusted because they were billed incorrectly or egregiously or whatever. And I think, and God bless them for being out there. I mean, those are some of the smartest guys that I know that are in that business, and some of the best fighters and advocates that are out there. But why are they even necessary? The fact that they're necessary is infuriating, and it's infuriating because what you have is egregious billing habits, lack of transparency on the part of the hospital, and then on the other side of the equation, you have carriers that are in this rampant denial cycle, which just basically creates this tornado of of bad billing, mismanaged billing, and customer dissatisfaction.
It's a mess that has to get cleaned up, and even though I know there's been government regulations passed about transparency, it certainly hasn't become apparent in anything that I've seen in the industry yet.
It's like crawling, over broken glass to get some of the folks to just, say this is what we charge. All right. And it's the same for everybody. It's not different because you're working for McDonald's or 65 and retired or working for, one of the major Fortune 500 companies. I mean, the fact that we're paying, when you're looking at a hospital that's already staffed, right?
Right.
Whether I go or not, it's staffed.
It's built.
Right? So the hospital is paying for X amount of employees whether I ever walk through the door or not. Right? So when I walk through the door, that's automatically a cash register going off, right?
Yep.
Why? I mean, if you and I walked into the grocery store and bought bread at different prices, one of us would be really mad. All right?
Yeah.
While we're not mad at the facilities for charging these crazy prices, doesn't pass my brain test and adds to this confusion.
Yeah.
When and continues that cycle of why is prices going up? Well, we had to resubmit claims 3 times to get paid. Well, why? Well, because the rates are different for every different carrier, and sometimes even the CPT code bundles are different.
Wow. I mean, I knew that was going on, particularly in the pharmaceutical industry, and going to even the same store and getting different prices on the same drug. I didn't know it was as rampant in the hospital billing.
It's really the same scenario, and the hospital billers, it's almost impossible for them to keep up because guess what? It changes every year. 99,000 CPT codes bundled, 100 million ways and different for every carrier. Well, we'll accept this, but not that. And then you go to the next carrier and they go, well, we'll accept that, but not this. And so it's, as I said, it's intentionally difficult, and it's one of the driving factors of increasing healthcare costs. How do we break that cycle? Get with a TPA that's your actual, fiduciary advisor that's going to work with you, give you that concierge service that you need.
Work with the patient advocates.
Work with the patient advocates. Why don't you deserve to be treated well?
Right.
Thank you very much. That was our episode of the Pulse of Healthcare.